Welcome to AMC Clinical Pearls. Today, we present a structured guide on how you can effectively prepare for the AMC MCQ exam in 2026. The AMC MCQ is the crucial first step toward practicing medicine in Australia. Our aim is to provide clarity on the exam structure and the clinical knowledge required. Let us begin by dissecting the fundamental structure of the AMC MCQ exam. The exam comprises 150 multiple-choice questions. Take note that only 120 of these items are scored, while 30 are non-scored pilot questions used for future exam calibration. You are allocated 3.5 hours for the exam. This equates to approximately 84 seconds per question, demanding disciplined time management from all candidates. To pass the AMC MCQ, you must achieve a scaled score of 250 based on a range from 0 to 500. This score reflects the level of competency expected of an Australian medical graduate. Understanding the topic blueprint is essential for you to be strategic in how to approach the exam. It is divided across 6 core subject areas. The highest weighting is allocated to adult health, encompassing medicine and surgery, totaling 60 questions. These high-yield areas must form the foundation of your preparation. The remaining 75 questions are distributed across child health, women's health, mental health, and population health, including ethics, each carrying a significant 15-question weighting. The AMC utilizes a predictable blueprint for question formulation. Questions are generally structured around clinical assessment, investigations, or management. Identifying the task being asked is key to selecting the correct response. For clinical assessment, it may ask more about the history, physical exam, and symptoms. For investigations, it may ask you to choose the most appropriate or initial test. And for management, it may ask you to choose the best treatment or next step according to Australian guidelines. It is critical to remember that all management and investigation questions must be answered according to current Australian clinical guidelines and standards. Let us review the first example. A 4-year-old boy is brought to the ED with a 2-hour history of barking cough and inspiratory stridor at rest. He is afebrile, but looks distressed. What is the initial clinical priority? A. Perform a lateral neck X-ray. B. Swab the throat for culture. C. Administer nebulized adrenaline. D. Start IV antibiotics. E. Examine the throat with a tongue depressor. Tip: the AMC loves safety first. In suspected epiglottitis or severe croup, examining the throat is contraindicated. The answer is C. Please refer to the RCH guidelines on croup. Next example. A 65-year-old male with a history of hypertension presents with sudden onset of severe tearing chest pain radiating to his back. BP is 190 over 110 mm mercury. ACT scan confirms a type B aortic dissection. What is the most appropriate next step in management? A. Immediate surgical repair. B. Start IV heparin infusion. C. Aggressive BP control with IV beta blockers. D. Give 300 mg aspirin and 300 mg clopidogrel. E. Thrombolysis with TPA. Tip: management is often based on Australian therapeutic guidelines. Type B is usually managed medically first. Answer: C. Aggressive BP control with IV beta blockers. Type B dissections are generally managed medically first, prioritizing blood pressure and heart rate control. To summarize, adopt the mindset of an Australian medical graduate. Questions are set at the level of a graduate Australian medical student or intern level. Don't look for the rare diagnosis, look for the common and safe one. Focus on the lead-in. Does the question ask for the most likely diagnosis? What is it? The initial investigation? What's first? Or the definitive management? What fixes it? Use Australian resources. The exam is strictly based on Australian standards. Use Murdaugh's General Practice, RACGP Redbook, and therapeutic guidelines. Time management. Since it's a computer adaptive test, you cannot skip questions. You must answer to move forward. If stuck, eliminate 2 options and make an educated guess. Thank you for watching, doctors. I hope I get to share with you some strategies. Please comment down below what topics you would like us to discuss. Don't forget to like and subscribe. All the best.